I'm Martin Maron. I'm the director for the Hypertrophic Cardiomyopathy Center and Research Institute at Tufts Medical Center, and also co-director of the Shannon T. Mast Hypertrophic Cardiomyopathy Center in Morristown, New Jersey, at Morristown Medical Center. And the study that we're going to be talking about today is Redwood-HCM. So the focus of this trial and study, Redwood-HCM, is on the obstructive form of HCM. So for hypertrophic cardiomyopathy, or HCM, 2/3 of patients have obstruction to left ventricular outflow and 1/3 are non-obstructive. And so the focus, today in terms of talking about this drug and the trial is on treatment, symptomatic treatment of obstructive HCM. And when we talk about the unmet need, in that group of patients, there are medical therapies which are good at improving symptoms, but the opportunity for additional medical therapy to help decrease the symptom burden that's due to the obstructive form of HCM is certainly one of the important unmet needs. In other words, giving patients who have symptoms related to outflow tract obstruction additional medical treatment options is really important. And that's really one of the large unmet needs, one of the important unmet needs in this segment of the HCM population. And that's really the goal of this initiative that we're going to be talking about today. Well, so CK-274, now aficamten, is a second generation oral myosin inhibitor. And the way that it works and the mechanism of action is that it decreases the number of at the myosin sarcomere level, the number of myosin heads that are interacting with active.